I mean, I would say that it just works every time. Anytime that the patients actually follow the advice, they get better. Okay. I have never seen a patient who follows the advice and doesn't get better. Because, as we said, by definition, diabetes is carbohydrate intolerance. When you take the offending agent out of the picture, the patient gets better. So that's all there's to it. This goes for type 1 and type 2, but now I'll focus on type 2. But, in type 1 diabetes, we can't really get rid of the requirement for insulin, nor do we want to. We need insulin. Insulin is not a villain. We do need insulin at minimum amounts, and we know that we want low amounts of insulin in our blood. So that's a different story. But that's a story for everybody. But in type 2 diabetes, it's very clear that we don't have to have diabetes. And to me, this is absolutely fascinating because nobody needs to be sick. All we need to do is take the offending agent out. And when that happens, the sugars drop. I have patients that start out with A1Cs of 15 who are actually doing fantastic now by just removing all the carbohydrates. And sometimes this needs to be tweaked. This morning, actually, I have a patient who has been struggling. And finally, once the dairy products came out, her sugars normalized. But with the dairy, they were still in the 300s, or high 200s. And when she took out the dairy, boom, it fell into the low 100s. So that's so, exciting because it's a process of tweaking, but, it doesn't take that long to figure it out. It's just a matter of playing with the different types of foods within what we call a ketogenic diet. But in general, my message is that anybody who has diabetes can benefit from this diet. And what I mean is, maybe we won't be able to get off all the medications. My goal is for the patient to be healthy. If it requires medications, that's fine. But let's use the right medications that lower insulin resistance. Let's try to get rid of the insulin as fast as possible so that we can actually resensitize the body to responding to insulin. So, type 2 diabetes is insulin resistance first. And then only later, one of the manifestations of insulin resistance is type 2 diabetes. But as you know, and other manifestations are stroke, cardiovascular disease, etc. So type 2 diabetes is probably the most common manifestation of the big diseases of insulin resistance. But type 2 diabetes is, first of all, insulin resistance. So we must treat the insulin resistance. How do we treat the insulin resistance? Let's lower the insulin levels. How do I lower the insulin levels? First of all, I lower the insulin as fast as possible. But second of all, I eat foods that don't increase my insulin, which are carbohydrates. And so with the combination of these two things lead to a very quick reversal. So to me, the goal is let's get the patient as metabolically healthy as possible. Let's lower the triglycerides, increase the HDL, get rid of the blood pressure, get rid of the high sugars. And all of that has one same treatment. So that's quite easy. Just get rid of the carbohydrates and don't be hungry. Instead, eat healthy proteins and healthy fats, or proteins and healthy fats. And then you will be satisfied. And it really works. The big problem is that we are addicted to carbohydrates. That's the real issue here. We're addicted to carbohydrates, and that's what makes it difficult. But if you have support and you have knowledge, education, and the will to do this, then there really is a way.